everyone, it's Danielle. Just wanted to do a recording so everyone's on the same page regarding the implementation plan review of 2024. So without further ado, let's jump on in. So back in December 2023 to January 2024, I met with a majority of our current staff at the time to discuss possibility, opportunities, ideas you all had in our department, not only to make our care better at the bedside, but bring in opportunity for other disciplines, maybe even have a little bit of fun, and just improve the experience as a individual within the department. We have accomplished a lot of things in 2024, so I felt the need to share these all with you. You've all done an incredible job. I did send out some communication before I went out on medical leave just to discuss if you had any other projects or saw any ideas. Just schedule or communicate with me via email, text, or by phone, and I'll get with you. I did have several staff members reach out in regards to studying for the ACCS. I do have extra additional resources when it comes to ACCS. You already have a bachelor's degree and you want to get a raise. You already have 3 years of experience. I can give you that information, so please feel free to reach out to me. We did have several people have degree advancement, which is a good thing within our profession, because they not only can grow us that have not reached their level yet, but we all could learn from one another. We also had some staff that are willing to precept some of our new team members. And also I saw a growth in engagement via social media, whether it be via Facebook in Respiratory Therapy Break Room or Respiratory Tigers, and along on LinkedIn. I will say that we're going to utilize this time just to review the 2024 goals and the stuff that we achieved, and additionally some things that we need to look out for in 2025. So this is a summary of the goals that we had in 2024. This is a lot. That is a lot of different goals that we have. I did create slides for a majority of these. There are two, however, I did not. And so I do want to talk about those or just expand on them a little bit. Our next generation team is middle school and high school students. So as you all know, probably Ken has been reaching out, trying to get staff members to go with him to the high schools in the local areas just to teach different high school students about our profession. Our profession has a severe shortage, and it's going to continue to grow in that shortage unless we educate people on what we do. How many of you didn't know what respiratory was before you jumped into it or even enrolled into the program? A majority of people, unless you had someone that you know and loved or yourself with a lung disease process. So there are several students out there that may be interested in this field and just don't know about it yet. This next gen team that I've worked with is Chrissy Garcia, Carolyn Dixon, Felicia Austin, Erica Hardison. We specifically focused on the middle schools in the more rural areas outside of Pitt County. So outside of Pitt County, there are health science academies, but they start in middle school. And that's just because of the college pathways that they used to take. They don't have all the resources that Pitt County does. And they are also smaller county schools. So we just got to keep that in mind. I know Felicia and Carolyn went out with me to a smaller school, and we didn't have time to paint pictures, which is why I don't have a slide on this, but the kids had a wonderful time. They were all hands-on, all asking questions. They had a laugh about it, and they got paid to teach about their profession, which is actually pretty cool. So just keep that in mind. Those opportunities are available. Another thing was working with our current respiratory care students and the schools. So we do have people that are clinical adjuncts in our department, whether they come in on their day off and work with a community college. They are taking some of the load off of our team members, and they're also taking that time to develop that relationship with the student and show them what ECU Health Medical Center RTs do. And so they're taking the time to step back, take a couple patients, and show those students, hey, while that therapist is just moving on along, they are thinking of this, and this is all what they're managing. And so the student goes, whoa, that is a lot, but I need you to break it down for me. So that is a good program. There are other CUs besides the one at Pitt Community College and UNC Wilmington offer through the AARC. There is one more, Carteret Community College actually developed a CEU. It's virtual, available on our online respiratory handbook, and it's available for you all, and it's primarily for us in this area along with the other hospitals that their students go to. So they just wanted us to have some knowledge of what their students are seeing, how are they feeling, and what are some things that we can work on to better their students, so challenge their students. So just keep that in mind, and we're going to continue on. So I did want to take some time and shout out to the ones in our department that completed some specialty projects and or have some in the works. So we'll talk about all of those. For example, Stella Smith continues to knit the blankets for the neonatal ICU. She does caps as well, and they've been very appreciative of that. Pam, Tammy, and Matt got together in collaboration with Brenda and organized the children's ED stop. I don't know if you've all been down there, if you work down there, but it's been very helpful to find things in one area versus scattered everywhere. So I find it helpful. I did go down there, and it's nice to have things where they should be. Another thing is that SafeNow reports are now accessible in real time to the assistant managers. This is very helpful when there's miscommunication, or it might be another department unaware of our policies. For example, there's a nurse out on the floor and writes an SI on Danielle because Danielle gave her medication an hour late. They may not know that I'm allowed to give albuterol an hour late because they're unaware of our policy. But this can be taken care of in real time. It's just a miscommunication. And that's part of our safety habits. So this can all be taken care of, which is really nice for not only the person that is in charge running the shift, but also the staff member as well, if there is needed some constructive criticism and or some education on the other team members' part. Another thing that we did was the CQI rollout. That's for the entire system. That isn't just our hospital, it's the entire system. CQI is going to improve our quality and safety standards. There have been, at this point, all of you pretty much have done a CQI. They will allow for our team members to have consistent report across the board with our patients. That is a big safety factor, is communication. Other things that are missed off in handoff, and so that'll be helpful. There are 2 people or individuals in our department that had specialty projects as well. They're still in progress, Tatiana and Andrew. Tatiana had a great idea for creating a list for the glide because they have been getting really junked up. Not sure about you, but I've picked up a glide not too long ago for intubation, and I found L&D equipment on it in 3 North. And I was like, okay, this doesn't belong up here at all. So I ended up trying to figure out where it went back to, which is L&D, and that takes time as well. So moving forward, we might look at this again. Unfortunately, it was put on pause due to our joint commission visit. We didn't want to start a new standard and there be confusion. Andrew also has been working night shift and requested for us to revisit cardiac surgery and neurosurgical ICU respiratory intubations due to the advanced practice providers not being comfortable and or lack of support from the supporting ICUs. So Ken should be working on this with the intensivist of the ICUs. Alright, so our Skin and Wound Champions team update. We have quite a few members on this team. We have Jessica Baker, Christy Garcia, we have David Ivey, Rochelle Butcher, Stacey Howard, and Macy Manuel. One big thing that we did on this team this year was the development of high-flow oxygen therapy pressure injury documentation. This went live earlier this week to differentiate between the non-invasive and high-flow groups. It had been up there, but for some reason it was disappearing, so Yami got with the IS and they have corrected that, and it's been great. Now we're able to track that data, ensure that we're doing what we need to be doing, and educate more on prevention strategies for this device. We continue to drill down healthcare acquired pressure injuries. Those do cost the hospital, and it is a hospital and system-wide goal to reduce healthcare acquired pressure injuries. If you've not listened to the overall year in review, our hospital system did not meet these goals. Respiratory related devices are one of the top medical devices for healthcare acquired pressure injuries. We're usually at the top of the list, and the last meeting I went to, we were 4th or 5th down the list, so we had some improvement. Good job to this team. Hopefully we'll continue to participate in like skin injury prevention week and stuff with the wound care team, so more to come on that. One thing that Brandy and I had been working on together was the creation of a respiratory therapy residency program. Across the United States, this is now becoming the new standard with respiratory care. In nursing, it has been evolved, especially here at the medical center, for about 10 years now, and that's standard throughout the United States. They actually have credentialing for that, and that's where the Center of Learning and Performance comes in. So we worked with them, looked at their templates, also worked in a national respiratory therapy collaborative group with people I connected with at the American Association of Respiratory Care, and they have some great ideas. They've had some great courses. Ours was beginning, so we didn't have as many classes for our new trainees to take, but they are able to help ensure that they continue their skills up throughout their orientation. So for example, Brandy and I, their first week of orientation, can go through everything, all of it, with the leadership team and then the assistant managers reviewing throughout their orientation. We can cover everything. The issue is that's a lot of information at one time in a short period of time, and not everyone can hold that capacity of information. I can't. I know I have yet to meet someone that can memorize everything they're ever being told. So this is a system that kind of helped with that and helped guide them. For example, they had this year some classes on such as Larry tubes, for example, like a deep dive on that, even though we already go over surgical airways. They went into APRV, we did ECMO, we did like a simulation hospital with different scenarios for this team. So it was nice to see them collaborate and get those skills and them working together and bouncing ideas off of each other. This really does enhance the confidence of the new grad. It also improves patient care. Over in Texas, they have the largest respiratory therapy residency program, and their job retention rate went through the roof across 19 different hospitals. So I'm hoping to see that here. It is really nice, and hopefully this will help us continue to adapt to healthcare changes. New team members that come in, especially new graduates, there is a disconnect between coming from clinical to coming to the bedside clinically as a respiratory therapist, and that can be uncomfortable. So we want to make sure that they're comfortable. I do hope to get some mentors in our department to kind of assist with this, be some guides or voices just besides the preceptor. That way they can have someone else to talk to and bounce ideas off of. Another thing we did this year is we expanded our research team. So our new team members are Carolyn Dixon and Chelsea Evans. They're working on current projects as well. Carolyn's working with Yami on a CQI expansion over all of our 9 hospitals. And then Chelsea's working with myself and the critical care fellows in regards to high flow oxygen therapy and the ROX index. Wayne and I are still waiting for the advanced respiratory mechanics IRB to be published. So more to come on that. We did have 2 publications in Respiratory Care Journal, and shout out to Sherry and Brandy for taking these photos. But we got put out there with AARC, so not only did you have to present at where your poster presentation is, but you have to go up in front of the room in front of every single person that walks in, even if they're still walking in, and go ahead and present. So I would like to see more of our team members involved in this, and hopefully we can have some team members next year present, not this upcoming year because you have to submit by January, but the next upcoming year. So shout out to everyone on this team. We do have myself, Chelsea, Carolyn, Wayne, and Matt, and Amber that all have IRB training. If you're interested in joining this team, I'll send you the training over. You have to complete those modules in order to participate in research training and research in general. We also had team members that wanted to create a respiratory celebratory committee. So these team members do holiday and team celebrations, special events within the community, or Respiratory Care Week. If you want to join this team, contact Columbia, Sherry, or Darian in order to join this team. There are several members on this team, So I have Dee Honeycutt, Paul, Susan Smith, Amanda Unsell, and Lauren Jackson. If I've missed anyone, I apologize. That's what I have documented, and that's for all of these things. But shout out to this team. Y'all did a really great job on Respiratory Care Week. We also had several team members help with interdisciplinary education. Tatiana, Dee Honeycutt, Joey King, Lisa Sims, Lindsay Brock, Chelsea Evans, and Erica Hardison. This is going across the physicians, fundamentals critical care support classes with physicians from all over, just not ECU Health, nursing students, nurses within our system, all throughout our system, because now the other hospitals are starting to come here. This is also geared towards physical therapy and occupational therapy as well. So far this upcoming year, if you would like to be involved in joining these teams, you're more than able to do this. I would be glad to have more people join or get involved in training our other disciplines, showing them what we are about, and not just be myself, because they see you all out on the floor more than they see me, and that's for day shift and night shift. So it would be nice for them to see that as well. These are the current dates as of this year that I have for like the ED simulations, the critical care MIU classes, the PACU nursing classes, and then there's going to be an advanced respiratory class, which is new for ICU nursing this year. We wanted to give them the basics, but they take these classes 2 weeks out of orientation, the first critical care respiratory class, and it's really overwhelming because they haven't learned about vents yet, really. They have maybe had a vent, but they don't understand the modes or what they're supposed to communicate if we're not there at bedside when we give handoff, and or if, for example, they're doing patient care rounds. There are some units or physicians that like to do these rounds at night, so those nurses as well want to be able to be informed so we can all work better together for our patients. We also had several team members that are super users within our department. We went through a lot of equipment this year. I know I changed it up and did monthly competencies. There's reasons for that. So some of our staff members had competencies from the early 2000s within their files. So it makes it look as though you don't work with that equipment and or you haven't checked off on that equipment in a very long time. So we want to make sure that we continue to validate those things. We did introduce new equipment such as the Hemosense C6, the IntelliOx tanks. The VibraPep therapy is just going live now. The Banyan phones with Yami. So shout out to these 10 members. You've been very helpful. We have Jasmine Wright, Jeremiah Wilson, Chrissy Garcia, Marion, Diane Tinsley, Tatiana, Jacob Creech, Chelsea Evans. There have been people such as Macy Manuel on night shift that have been helping. So shout out to all of you for working together, helping each other so we can ensure that we all are doing what we can with our equipment and understanding it. Hopefully we'll continue doing that. We've had some hiccups along the way this year so far with our Hollisters and ensuring that everybody needs to know how to tape. So for right now, we're holding off on anything. So our goals for 2025, if you have specialty projects you'd like to work on, please get with me. I'm available by email, my phone, my Outlook calendar. If you look at your email, there's a little calendar. You can actually schedule time with anyone in our department. So if you look up that and you actually click scheduling assistant, you'll be able to see if when I'm available or not. Just an FYI if you're ever wondering. So one thing I want us to do is kind of work on expanding that research team. We want to review some grants that we might be available for. So for example, Aerogen does a lot of research. How great would it be to have Aerogens for every single patient on the adult side? It'd be wonderful. So if we could get some other team members to participate in research and get some grants, hopefully we can improve not only our equipment, but is what we're doing being effective for patients. So I want us to continue on that, continue interdisciplinary education. I do have another project in regards to education that I've been working on. I want some of your feedback as team members as well, because you're at the bedside, but we need to develop a tracheostomy education training checklist for the caregiver to have at the bedside. We need that for adult services. So Children's Hospital already has a pathway for that. In adults, it's never been identified. You have to change this many trachs before you leave. We need to see you do this many times. Yes, we have the documentation within the flow sheet through the education group. but that is not shared with the patient or the patient's family. It would be nice for them to have that. There has been some issues with readmissions of trach patients, specifically because they don't feel educated enough, and that went beyond our department. That went to higher ups. So we have got to get the ball rolling on that. There are some meetings for that, but I haven't been able to attend one this year. They've been canceling them just due to the emergency operations and being in the red. I want us to continue to develop CRCEs and continuing to review those equipment competencies. My goal is to ensure that we can get our CEs while we're here, making sure that everybody has that available for them. Strengthen our adult team coverage. So we have a lot of staff members, probably about 40 in the adult side, that work our specialty areas, do charge or do ECMO. That is absolutely wonderful. If you want to do any of that, make sure that you get with your assistant manager and or Heidi and learn more about that process. Our next gen team, it would be nice for more people to get out in the community, reach this younger population that is now being told, hey, we need you to go ahead and select a career, and or just get their minds working kind of towards that career, which would be nice. As you all know, you probably see all the emails from the North Carolina Respiratory Care Board. There is a huge shortage of respiratory therapists across the country, and North Carolina has a lot of respiratory therapists. So we would just want to ensure that we continue to grow in our profession. The Respiratory Celebratory Committee, I'm sure they would love to use some more hands, especially for Respiratory Care Week. That's a big, big project in itself. So contact any one of those ladies that oversee that committee. Another thing is to continue to build the respiratory therapy residency program. I would like to merge some of our staff with and mentor. Some of people asked about mentorship. That would be really good for some of our new grads to have not only just their preceptor, but someone else that they can talk to as well. The Skin and Wound Champion team, develop more education material. We don't just serve as like everybody here at the medical center, we also serve as educational information out to the regionals as well. So it's really nice, whatever we do here at the medical center, I share to the region. So they would love some more education, just like many of our staff would. Another thing is that we have collaborative team opportunities with other facilities nationally. So there is a spinal cord injury committee. There is a tracheostomy collaborative group. There's an education collaborative group. If you're interested in any of those, get with me. The ARC, if you're not a member, they did have new leadership 2 years ago. It has changed a lot. They want more team members involved and are moving in the right direction of getting us more national recognition, specifically after COVID, because they had different administration during COVID. So they are working really hard. Dana Evans is president. She's working really hard to ensure that everyone's voice is heard. So if any of you want to get with me, do any of those things, that would be great. If you have other ideas and things that we can work on in our department, if not, I'm just going to continue on what we were already doing and what you all suggested, and kind of align with what our whole department goals are as well. So we want to ensure that we align with those. Shout out to anybody that's been on this line here the entire presentation, but just emailing me or schedule a meeting with Brandy or I to discuss opportunities or joining a team. I'd be more than happy to talk to you.